Donald Rumsfeld famously once said, "There are things we know, there are things we don't know, and there are things we don't know we don't know." Clearly, at various points, particularly early during the pandemic, you must have been in one of those moments. How did you process?
Yeah, well, that's a great question, and it leads to a lot of confusion, because when you're dealing with a moving target, and God knows COVID was a moving target, moving not only in reality moving because we had different variants, we've never seen that, ever, that in one disease you have alpha, beta, gamma, delta, Omicron, multiple subgroups of Omicron. But importantly, as the information was coming out, we didn't realize how well it was transmitted, because the Chinese were saying, oh, it's a virus that's not very well transmitted. Because remember, SARS-CoV-1 in 2002, some of you may remember, 8,000 cases, 781 deaths. It was easily suppressed by good public health measures. Why? Because it didn't readily spread from human to human. So when this new coronavirus came out from China, the Chinese thought, oh, well, it's just like SARS-CoV-1. It doesn't spread very well from human to human. So the first week, we thought it didn't spread very well. And then all of a sudden, it became clear it spreaded pretty well. And then it spread very well, and it spread like nothing we've ever seen before. So in the first weeks, you make recommendations based on the data that you have. So the public wants to know, what should we do? Should we worry about this? Should we wear a mask? Should we do this? And the information is here. When the information changes, science is self-correcting. So you have to change your recommendation. And then when other things change, so that led to a lot of confusion in the public saying, well, the scientists, they keep flip-flopping. We weren't flip-flopping. The situation was changing. And the only way you're people think about science in general as immutable. Science is a mechanism whereby you gain information, evidence, and data, and then you can make your decision or not. People in the beginning thought that the science of COVID was like math. So in math, 2 + 2 = 4 in January of 2020. In June of 2024, 2 + 2 still equals 4. Is the virus the same in 2024 as it was in 2020? Not even close. So you got to be careful that you don't mix up things when you're dealing with a moving target. So that's an example, Ted, of back then, we didn't know what we didn't know what we didn't know.